All right. Hi, guys. This is my part 2 of why. As I said before, I am here to help everybody in their fitness and wellness journey. The reason I'm doing these live videos is because I can make them a part of a series under my reels, so it kind of categorizes them a little bit differently than it would any of my fitness videos or my instructional videos or my motivational videos. So why did I start doing this? It's kind of a long story and also a short one at the same time. I used to be a physical therapist assistant, and of course 2020 hit. In 2019, I was working in a clinic, and my patient had told me about a virus that was going around in her mother's community in China. And she was very worried because her mom was walking to everywhere and buses were shut down. And she asked me what would happen if it got here. And fast forward, now I have 2 kids. I was pregnant at the time with my second child. And I made the decision to walk away from physical therapy at that moment in time because it wasn't safe for me to be in the clinic. I did not want to bring the virus home, and I kind of just decided to be a mom full time. As the kids got older, I had more free time. They're not that old. I have a 4-year-old and a 2-year-old, and I love sharing fitness and health stuff with them. I am not a strict mom, to my knowledge. I let them jump, I let them run, I let them play. They have cookies, we make cookies, they eat the cookie batter. You can come at me for that. But a lot of my friends and family were always asking me, how did I lose the weight after my first child? I had gained 80, 90 pounds is when I stopped counting, and I had gestational diabetes. So in what happened in a very short span of gestational diabetes, I got diagnosed. I was going hypoglycemic after eating, and I just could not regulate my blood sugar. I had gained so much weight. My hormones were kind of fitting in the key and pocket and where my insulin should fit. And what was happening is my body would produce more insulin because my hormones were fitting where my insulin should have gone, and I would bottom out. I eventually got on insulin after being on metformin, and that is another story for another time because I know there are a lot of women out there struggling with gestational diabetes and struggling with weight gain during pregnancy. So I will address that and how I avoided it with my second child. So now I'm at home with 2 kids. But before, when I just had 1 kid, I was working full time, was not happy with my work-life balance, and I cut down to part-time. I went back to my old company, NovaCare, and I started working out more. I was on my bike. I was beating myself up though. I was not losing weight. I was pumping. I was stressed out. I was not getting enough sleep. And I just could not lose the weight. And I felt guilty. I had gone from being a 3, 4, 5 day a week runner, lifting weights, cross training, to somebody who couldn't walk around the house or carry her son without knee pain, shoulder pain, back pain. So it was very frustrating for me. And pumping kept the weight on me. Having to produce milk, even though I was a low supplier, the stress of it, the hormones of it, I just could not lose the weight. And finally, my husband looked at me and asked me why I was so mad. And I told him that it was because I was not the person that I used to be, and I felt guilty for not being able to give my son enough milk. And I felt all of these emotions, and he finally told me, the only person that can make you feel guilty and can really make you feel bad is yourself. So after a long time of soul searching and thinking about what I could do, I finally just dropped the guilt. I'm not going to be the perfect mom. I'm not going to be the perfect fitness person. I am definitely not going to be the perfect eater. But I can try. I can try to do better. So I established some boundaries for myself. I wasn't going to restrict what I ate. I wasn't going to punish myself for eating or by working out. And I was just going to enjoy the moments with my son and my husband and my family. And I would worry about the rest of the stuff later. My supply was what it was. It was low. I could manage my time. I could manage my sleep. And I could not feel bad about what I was doing. Eventually, about a year later, I lost almost all of my pregnancy weight, all but 5 pounds. And that was mostly because I was in my best friend's wedding as a bridesmaid and I was extremely motivated. I also had a very bad allergic reaction to toothpaste that helped. Now, I got pregnant with my daughter and I knew I had failed the gestational diabetes test at 22 weeks. So they were going to monitor me closely. And I have never done keto in my entire life. I had tried keto recipes. I had said I was going to eat keto. I said I was going to eat healthy. And I just could never stick to it. But I had a reason to stick to it this time. This time it was for my daughter. It was for my son. It was for me. And so I could be there. Because if something happened to me during my pregnancy or labor and delivery, there was a chance I couldn't be there for my kids. So I stuck to keto about 90% of my diet. It was hard. It was low carbs. And I had doctors on board to help me go through this process. And I also monitored my blood sugar regularly to make sure I wasn't getting gestational diabetes again. And my glucometer was actually off, which makes me really mad because it makes me question, how are we accurately measuring people with diabetes, type 1 and type 2? I took my 1-hour glucose test at the OB's office and they did a blood draw. I tested my blood sugar 30 seconds before that nurse walked in the room and I measured 156 on my glucometer. When I got my blood draw back, I was 117. That's a huge discrepancy if you know anything about diabetes. Before my doctor even could come in, I was thinking about everything I had to do. I was going to ask for metformin. I was going to ask for an endocrinologist. I was going to get on a dietitian schedule. And she told me, wait, let's get the results back. Let's act as if you have gestational diabetes and we'll go from there. So, like I said, I've never done keto, but I watched it. And knowing my glucometer was off by quite a bit made me watch what I ate even more. And it made me get introverted into myself. And I guess introvert is the wrong word, introspect into myself about how I felt when I ate and how I felt when I worked out. So I kind of put that process together, and during my second pregnancy, I did not develop gestational diabetes at all. I gained the recommended 20 to 25 pounds, and I was in out, and I was literally just looked like I had stuffed a basketball under my shirt. After I had my daughter, my weight jumped up because I added carbs back in. I did not want to be on a restricting diet with 2 children because what I was making is what they were also going to be eating. So I jumped up about 25 more pounds. So a total weight gain about 45, 50 pounds, pregnancy number 2 and postpartum number 2. I finally decided it wasn't a big deal. My weight was going to be my weight. I was going to pump for 2 years, or as long as I needed to give my children protection. And this time around, I had a very large supply. So I was donating to the NICUs and helping other moms out as they needed to. Because despite what they tell you, about 70 to 80% of moms will have a low supply. I wish they would have told me that at a doctor's appointment. So now my daughter is 2. And I am probably in the best shape of my life. I was a college athlete at the University of Iowa. I ran track and cross country. I did get injured there, but I have never been this athletic. I saw what my body could do with my daughter when I was pregnant with her. I didn't push myself extremely hard, but I was there and I was working out and I saw the things I could do while growing another human, and it was kind of a light switch. I decided that I'd given my body to my children for 4 years between the pregnancies and the pumping, and after I was done, I was going to dedicate that same time, 4 years, to myself and rebuilding myself. Granted, I did work out those 4 years and do have a baseline, but I have discovered that the more that I push myself and challenge myself, the more I surprise myself. So as a former personal trainer, I was a strength and conditioning coach. I worked in physical therapy. I always see my clients, my patients, my student athletes, they would always put barriers on themselves. So I'm here to help strip away those barriers. I'm here to take away your excuses. I'm here to help you work out, and I'm here to help you feel better about yourself. I'm not here to judge, and please don't judge me. I just want to be here and I want to be supportive. A lot of my friends have injuries. They text me, my shoulder hurts, my hip hurts, what can I do? Or I see them at parties and they're like, I've been hurting for months. And I'm like, why didn't you reach out? So a lot of my content is gonna feel all over the place. There might be a reason for that in the beginning. Someone may have messaged me and said, hey, this is hurting me, what can I do? So I'm just here because my journey isn't over yet. I don't feel like I'm done helping people. I love helping people, and I have the background knowledge, I have the education, and I'm here. All of these books and all my certificates and all my knowledge are doing no good in the crawl space. They're not helping anybody, just being in my brain. What I can do and how I could help motivate people is more beneficial than just sitting around and trying to find a new recipe to cook in my book. I could easily go back to gym. I have had offers to be a personal trainer. I've had offers to be a group fitness instructor, and I don't want to right now. It's a lot of time. It's a lot of time commitment. And in the 3 weeks that I have been on Instagram, I think I've reached I know I only have a small amount, 94 followers. Thank you guys. Love you all. If you have any questions, please reach out. But I think I've reached 20,000 accounts, and that blows my mind. Even if you don't follow me after seeing a video, I am perfectly fine with that, because maybe I taught you something. Maybe I gave you an idea. Maybe I motivated you, and that is why I'm here. I want to help people, and being in the gym for an hour helping one person, getting paid to do it, and then stressing out about their results and their goals and how can I do this better, I can make you guys feel better about yourself, and I can help you guys reach your goals. And I can reach a lot more of you guys in a short period of time than working in a gym. And I really love it. I do. And I could hold up all my certificates. I could bring out all my books. And for some of my not courses, but some of my videos, I might show you how I am an expert in this field, or some certain diagrams from a course that is going to be beneficial for you to help you better understand it. We all learn in different ways. So I'll have visual, I'll have audio, I'll have tactile, I'll give you cues. If you have any questions, just reach out to me, email me, text me. All my information's on my page. I want to help you get better. I want to help you feel better about yourself. I want to strip away the guilt. The only person that can make you feel bad is you. That is just a big mental barrier that you can just take out of the way. You don't have to eat healthy. I don't. I eat healthy, I would say 75% of the time. I try to keep a 1/3, 1/3, 1/3 rule. 1/3 of the time, I'm going to be really good. Another third, I'm going to be good. And another third, I'm just not going to care. So 2/3 of the time, I'm good. I like those odds. And the other third, I'm just not going to punish myself for enjoying a slice of cake, enjoying a donut, eating cookies with my kids. And it's going to help me enjoy my life and spread my energy and my joy to others, because I am not feeling bad for something I did to myself and making myself feel bad about it. I hope that helps. I know it's kind of a confusing circle to follow, but I'm here. I'm probably going to be here for a while. My goals are to get this content loaded between exercise videos, full exercises. I want to get somewhere between a 5 to 10 minute full video recorded. I used to teach small group classes. And I encourage you, go find a gym, go try it out. No one is judging you. The only time that people will look at you, it's because they're jealous because they wish they could start over like you. They know if they stopped, they probably wouldn't start again. So try a gym. If you are intimidated, email me, text me. I will help you get through the door. I'm also going to try to have some small group classes. I may take on some clients virtually right now, but again, it's all going to be on a need basis. If you need me, I'm here. So whatever I can do to help you on your fitness journey, you know where to find me. And I'm here for all ages. I have worked and trained, like I said, from pediatric cases. I think my youngest patient was 4 or 5 years old, getting them into some mobility and getting them to walk with their feet flat. That was fun. I've worked with little kids that had torn their ACLs because their parents bought them bikes and had them jump on trampolines and all these fun things that my kids will never get the joy of doing because of it. I've worked with amputees, paraplegics, quadriplegics. I've worked with former NFL linemen. I've worked with a lot, and I have a lot of knowledge to share based on both my experiences and my education. So thank you guys for coming to my very long intro video. But what really is going to motivate me is, seeing you guys and seeing your results. And so just text me, email me, whatever you need. I'm here. I do have 2 kids and a dog and a husband, but I will get back to you as quickly as I can. So thank you again. Like I said, the reason I'm doing these live videos is that I can put them in a series, and it's easier for you guys to then find it and kind of find out more about me. I will dive more back into my gestational diabetes journey, both pregnancy number 1 and pregnancy number 2. I will dive into my personal training history. I will dive into my strength and conditioning. I have summer programs for kids. I want to help your child too. So it's not just you. If you have a child who wants to get into sports and they don't know how to start, and most kids are very gangly and uncoordinated, I am more than happy to help. I also will dive into my physical therapy background, and I will teach you how to do cupping and work with tools at home safely. I will also teach you guys how to prehab, which is pre-rehabilitation for surgeries, and anything else that comes up. Also, runner self-defense is coming, and runners mobility, and specific runners and endurance videos. So like I said, there's a lot to get out, and I don't have that much time during the day, but I will get out as much content as quickly and organized as possible. Just bear with me in this beginning phases. Thank you guys so much.